remember one time, attorney had me mark 52 exhibits, and he used 2 in the whole deposition. I think he had big plans. I don't know what happened that made him stop early. All right, can you raise your right hand, please?
Sure.
Do you solemnly swear that the testimony you're about to give will be the truth, the whole truth, and nothing but the truth?
I do.
Dr. Huffman, can you state your name, full name, and job title, please?
Sure. Jeffrey Clifton Huffman. I'm the medical director of inpatient psychiatry at Mass General.
How many years you have worked in Mass General Hospital?
I've been an attending psychiatrist for 10 years.
For
Sleep, I ask you to keep your
Oh, yeah.
speak louder, please.
Okay. For 10 years, which medical school you came from?
I came from Baylor College of Medicine in Houston.
How to spell?
B-A-Y-L-O-R.
B-A-Y-L-O-R. Baylor Medical School. Thank you. Which place you finished your undergraduate degree?
Bowling Green State University.
Bowling. Can you spell?
B-O-W-L-I-N-G.
I-N-G.
And the new word, green, G-R-E-E-N. And then State University.
State University. Which major for your bachelor?
For my bachelor's, math, biology, and chemistry.
Thank you. If you can see the exhibit 1, is this your information?
Yes.
What it means you are director of some research group? What does that mean?
I also am the director of a research program to help patients who are depressed and also have heart problems.
But what is that English word called? Some
Cardiac psychiatry?
Yeah, what it means?
So basically, cardiac relates to the heart problems with the cardiac system, people who have heart attacks or those sorts of things. Psychiatry has to deal with, mental illness and psychological conditions. And so our research program studies people who have had heart problems and who also have depression, and we try to help people who are feeling depressed, for example, after they've had a heart attack.
So is that your expert area?
Objection, you can answer.
Okay. I think I have expertise both in cardiac psychiatry and in inpatient psychiatry. I'd split my time equally among them and have been doing them both for about 10 years.
Oh, so you also worked in cardiac department?
No, psychiatry.
You're still in psychiatry department. And you also worked in Harvard Medical School?
I'm affiliated with Harvard Medical School, yes.
You are some professor, if according to this?
I'm a clinical professor, but I don't teach any classes at Harvard Medical School.
Okay, but I don't understand. So you finished the PhD before?
No.
No. Oh, you call clinic professor?
Yes.
Thank you. Can you
Sure.
give me this? Thank you. Generally, you know me when you see me.
Yes.
So you remember me.
Yes.
Generally, how the impression for you when I was in MGH?
Objection, you can answer.
You were a patient under my care. I wanted to help you as much as I could.
Which year?
I believe it was 2008.
And how long? Do you know?
How long did
Did he treat, or how long were you present in the hospital?
How long you treat me back to that time?
Approximately 3 weeks. I don't recall. the exact number of days.
Thank you. In your memory, was I rude, polite, or anything act very bad or not bad?
I remember that we were able to have a reasonable set of engagements. I remember there were times when you became upset. I remember there were times when you were very calm. Overall, I felt like it was a reasonable working relationship.
Did you feel was Miss Lee at any time threatened you?
Threaten me?
Yeah.
No.
And did you hear anything anybody complained Miss Lee threatened others?
Objection, you can answer.
I believe there was something in the record that I reviewed that mentioned verbally threatening. I did not witness that.
You did not witness that.
I did not witness that.
Did Miss Lee told you that was false?
I don't recall.
Let's see. This is marked Exhibit 4. If you can tell what it is.
Okay.
So do you remember it?
I remember this letter.
You remember this letter? And did you pass this letter to Dr. Parker?
No.
No? Do you remember Miss Lee asked you send this letter to Dr. Park?
I don't remember passing it to Dr. Park. A member of our team may have passed it to Dr. Park. I don't remember personally passing it to Dr. Park.
So you remember the team passed this letter to
Objection.
Dr. Park?
Objection, that's not what he said.
Okay, what do you remember about this letter?
I remember seeing this letter, and that's all I remember. I don't remember whether it got to Dr. Park or how it got to Dr. Park.
Thank you. And can you see that? Yeah, thank you. Do you remember if Miss Lee ever complained when you treated Miss Lee there? Miss Lee ever complained the word about a verbal threaten was a defamation?
I don't recall.
You don't recall? Let me see. Can you tell what this paper is, please?
This looks like the let's see. This looks like the affidavit for the 8B hearing. Okay. One moment, I just want to make sure I understand what this is. I believe that this is the authorization for you to receive treatment against your will following the court hearing.
Can you read through the top one? One that's handwritten, please.
Sure. To Diane Garrity, please write it accurate. See below. Thank. Could you send new written to court, please? Young Lee. 10/9/2008.
Do you remember who's Diane Garrity?
Yes.
Who was she?
She was the counsel, the legal counsel representing the hospital.
And do you remember why Leslie wrote down on the top?
No.
Oh, did Miss Lee ask you to send this paper to attorney, how to say, Garrity?
I don't recall.
You don't recall.
I don't.
And did Miss Lee complain to you that authorization from the court included the word, say Miss Lee threatened others, was defamation?
Objection. You can answer that.
Okay. I honestly, I believe, I don't recall.
But do you recall this attorney?
Yes.
You remember this attorney came, and you just you don't recall anything Miss Lee complained the defamation.
Ms. Garrity worked with us on, I've probably worked with her on 20 or 30 cases, and so I don't remember the exact details of this particular interaction.
Okay, yeah, thank you, Dr. Huffman. But how did you remember? Could Miss Lee, you said just now you heard someone complain Miss Lee threatened others?
Objection. That's not what you can answer.
Somebody?
Okay. I believe when I was reviewing the records in preparation for this, I believe that I saw something about verbally threatening, but I don't remember the circumstances.
So I don't remember.
Sorry, the circumstances.
And do you know who complained?
I don't recall.
You don't recall.
I don't recall.
Could that be Miss Lee complained?
You complained that you were verbally. Could you rephrase the question?
You don't understand my question?
I think there's a miscommunication. Dr. Huffman is saying that he recalls in the record that you were verbally threatening to someone.
You recorded in record Miss Lee verbally threatened others.
I recall in the record that there was some notation of a mention of you being verbally threatening. I don't recall who wrote it or the exact circumstances, and I did not witness it.
Okay. Back to the Exhibit 4. If you could read through this letter, please.
You could read it to
Read it.
yourself.
Oh, okay.
If you can read, so letter.
Do you want me to just go
You
ahead?
want her to,
Yeah.
you want her to read it out?
Yeah,
Okay.
please.
Dear Dr. Park, yesterday I told you that Dr. Yaroshenko lied in her affidavit, and you were angry and adamantly claimed that she did not lie. However, it is my
You
obligation.
want to go a little slower.
Oh,
for the
sorry.
recorder.
I'm sorry. However, it is my obligation to let you know the truth. See the enclosed page, the last paragraph of the page 2 affidavit. Quote, of note, Miss Lee has also verbally threatened others, parentheses, as described above, but, ... Close quote. The statement, Miss Lee has also verbally threatened others, is false, and you can ask anyone in the Blake 11 to confirm it. Regards, Dr. Huffman testified that I was polite to others. Very truly yours, Young Lee.
So, could the verbally threatened others, you got the knowledge from here?
That's possible.
But in your memory, if anyone told you, if any people in the mental section complain to you, say, oh, Miss Lee threatened her or threatened him, have you ever met something like this?
I don't recall that.
Don't recall. Thank you. Thank you. to that time when you gave Miss Lee treatment, do you feel you fully understand what Miss Lee said, or how do you feel?
How do I feel? When Miss Lee was receiving treatment, I felt like it was the right thing to try to help Ms. Lee recover.
I mean, do you feel you understand Miss Lee 100% or 90%? How much? How much?
While you were receiving treatment or
Yeah,
now?
yeah, back to that time when you talk or listen or communication with Miss Lee, how do you feel?
I never recall any problems communicating with you during our interactions.
So you will fully understand Miss Lee.
Yes.
And do you think Miss Lee fully understand you?
Yes.
Objection. Yes, that's fine.
And how did you believe Miss Lee fully understand you?
We spent many minutes and hours speaking together in treatment team rounds, and any time I asked a question or we had a conversation, you made very clear responses, very consistent responses. Everything that you told me was understandable, and it seemed that you were understanding what I was saying.
So Miss Lee, in your memory, Miss Lee understand you very clearly.
Yes.
And Miss Lee, the words Miss Lee told you, consistent.
Objection, you can answer.
I understood what Miss Lee told me. Yes.
But you said what Miss Lee told you, consistent.
Objection, you can answer.
You said just now, if
Usually, yeah, within an interview, the things that you would say would be consistent. There were times when it seemed your ideas changed over the course of days.
what do you mean over the course of days?
You may have had a belief or a description one day, and then several days later or weeks later may have had a less strong belief about a particular thing.
Less strong about the particular things. So you remembered very clear.
I remember that it was easy to communicate with you, and that there were no problems in comprehension.
You remember there was no problem and for the comprehension. Is that what you say?
Yes.
What means comprehension?
Comprehension, understanding.
Comprehension, understanding. So you can confirm Miss Lee completely understand you.
Objection, that's not what he said. You can answer it again.
My experience was that when we had a conversation, the information that you conveyed to me, I understood, and when I made statements, it seemed quite clear that you understood what I was saying.
How many languages have you ever learned before?
I speak English, and I speak, I would probably say I'm somewhat fluent in Spanish.
Is it very good when you speak Spanish?
See that again.
Is it very good when you speak Spanish?
No.
No, but have you ever have experience to treat patients who speak Spanish?
Yes.
What language did you speak?
English.
So you still speak English with the people who speak Spanish?
We have a very low threshold for getting interpreters if those are needed, but I would not conduct an interview myself in Spanish.
But did the patient ask interpreter?
Yes,
And did you provide it?
absolutely.
And did the patient ask a doctor speak Spanish?
Objection.
Right, sure.
You can answer.
Okay.
You're asking him whether in his entire 10-year practice, whether
Yeah,
anybody
yeah,
has
in your
asked him.
experience, yeah.
I don't recall that they have.
Which means they never ask the doctor who speak their own language.
Do they ask for? I don't recall a patient asking for a physician who speaks their own language. Our experience is typically that our interpreters are very good and patients are satisfied.
So how many years in MGH you worked?
10.
Okay, if you can estimate what's how much the patient who speak English is not their first language, means they speak other language.
If there's any way you can
Yeah,
estimate
five.
without guessing.
Yeah, 5 to 10% would be an estimate.
5 to 10% patients, and they never asked you to provide a doctor who speaks their own language.
I don't recall at this moment that there was one.
Did Miss Lee ask you find a doctor to speak her own language?
I believe so, yes.
So there are someone.
Yes, I misunderstood. I thought we were speaking outside of yourself.
No, I asked for your experience.
Okay. In that case, then there's been one patient. It's you.
So you recall that I'm the only one, Miss Lee was only one to ask you to provide a doctor speak her own language.
That's my recollection at this time.
And in your experience, what's the difference? What's the difference if you evaluate a patient with first language and with second language?
Objection, you can answer if you know.
Anytime you have a patient for which there is shared language or other aspects, it can be helpful to the patient because they speak the same language. At the same time, with the interpreter services that we have, I can never recall a complaint or any problem in understanding the patient when using an interpreter, and that seems to be rather helpful in managing the patients that we care for.
So do you think the evaluation will be same regardless first language or second language?
I can't say if it would be the same.
Can you say be same? Yes or no? Same or not same?
If you can't answer yes or no, you can answer however you feel comfortable answering the question.
Yeah, I can't say yes or no.
You can or cannot?
Cannot.
You cannot say yes or no.
That's right.
And so you believe they may be same. If you evaluate the person speak her second language.
You're saying through the use of an interpreter, all these questions are with the use of an interpreter.
That's not my question.
So you're asking somebody that doesn't speak English and not using an interpreter? Is that the question?
No.
Okay.
My question is, well, because you are a doctor doing lots of research, means generally, it's not based on Miss Lee's case. Generally, if a patient be evaluated with her first language, and then compared to the evaluation with her second language, if you compare to the two evaluations, do you think that should be same? Should be same result?
With a non-English speaker with not the use of an interpreter? I'm just trying to understand.
Okay, without the interpreter.
Okay, so somebody that doesn't speak English without an interpreter?
Yes, it doesn't matter English. So for
well,
example,
if they either understand English or they don't understand English.
or
So when you say,
maybe French, okay.
well,
It's general because you have experience about the research. It's just like kind of research. My question is, for example, in China, back to 2009, they arrested a British man, drug dealer, and sentenced him, capital death sentenced. And Britain submit the medical record from Britain, which means English evaluation confirmed the man suffered depression. Chinese government rejected that evaluation, and the Chinese government provided a Chinese doctor, but with interpreter English, and confirmed the guy no any mental problem. And in only a few months, the man was executed. I don't know how to say executed or executed.
is there a question?
The question is, how do you think the difference between the evaluation in English record and also the evaluation by Chinese doctor with the interpreter? Do you think they should achieve the same result or not?
Do you understand the question?
I do.
Okay.
I think I've essentially answered that question before. I can't say whether it would be the same or different.
That's your answer.
So you see, you cannot answer they are same or different.
You're asking, you're asking a general question about the difference between a primary language and use of an interpreter, and the doctor has answered this question more than once, that he doesn't know the answer, he can't answer yes or no.
You don't know the answer. Okay, and back to the case for Miss Lee. You believe you communicated with Miss Lee very well,
Yes.
correct? And you fully understand Miss Lee, correct?
Yes.
100%?
To the degree that I could provide clinical care just as they would with any of my other patients, yes.
And you believe Miss Lee understood you
To the degree
very well?
Yes, to the degree that with any of my other patients, yes.
And 100%?
Objection, you can answer.
To the degree that I was providing the best clinical care that I could as with any of my other patients, yes.
Yes, but you diagnosed Miss Lee delusional disorder, correct?
Yes.
And do you remember Dr. Albert Young?
Yes.
And do you remember Dr. Young came to interview Miss Lee?
Yes.
Do you remember Dr. Young's result?
His report, yes.
What the diagnosis?
I don't recall.
You don't recall. Let me see. Just a second, please.
Okay.
This is Dr. Young's report. I will, after this, I ask you help me with Mark exhibit.
Okay.
Thank you.
Yes.
Can you read through the last sentence?
This.
Mm-hmm.
I do not consider there is sufficient evidence that patient suffers from psychosis or from a psychotic disorder.
what it means.
He did not consider that there was sufficient evidence that you suffered from a psychotic disorder.
Is it the same as or similar to the result, the diagnosis you gave Miss Lee?
No.
And do you understand Dr. Yang speak Mandarin?
Yes.
And do you know Dr. Yang interviewed Miss Lee in Mandarin?
No.
No?
Oh, I'm sorry. Could you repeat the question?
The question was, do you know? So,
Oh, yes.
And did you read this, did you, how to say, did you know Dr. Yang's diagnosis after the interview, back to that time?
I saw his note in the chart.
Yeah, but did you know the diagnosis?
I read this report.
So, did you understand that Dr. Yang shared a different diagnosis?
Yes.
And how do you understand why your results are different?
There were probably 5 or 6 psychiatrists who evaluated you, and when there are 5 or 6 psychiatrists evaluating a single person, different physicians sometimes have different opinions.
Do you believe that 5 different doctors came for interview? What languages do they speak to Miss Lee?
English, except for Dr. Young.
And do you understand what is mother language for Miss Lee?
No.
You don't know what the mother language Miss Lee speak?
I assume Mandarin. I don't recall at this moment.
But you knew English was not Miss Lee's first language.
Yeah.
Sure. You can answer
Yes.
Why you object such question?
to the form of the question.
To the form? Or I think the question very simple.
That's fine, I'm objecting for the record.
So, you knew there's a difference between you and Dr. Yang.
That was one difference.
There was one difference.
Mm-hmm.
And you rejected Dr. Yang's opinion.
No.
So, you did not reject Dr. Yang's opinion?
No.
Then why you still keep Miss Lee there?
My evaluation of Miss Lee involved reviewing and discussing the case with several psychiatrists.
Mm-hmm.
Dr. Sorrentino, a forensic psychiatrist, Dr. Yaroshenko, reading Dr. Young's report, and most importantly, doing my own clinical evaluation in many meetings with you. Based on all of that information, all of which I considered carefully, including Dr. Young's evaluation, my clinical opinion and determination was that you had delusional disorder. Understanding that Dr. Young may have had a different opinion, while at the same time many other psychiatrists who evaluated you and my own clinical evaluation suggested that in fact you had delusional disorder, and that was my conclusion.
So you mean suppose 5 other doctors speak second language interview compared to one doctor who interviewed Miss Lee with mother language, and you believe the 5 languages are more accurate?
No.
What do you mean no? Then who's accurate?
I based my opinion primarily based on my clinical evaluation of you myself, which I did over the course of many days and many hours. I also took into account all of the information from the chart, Dr. Young's evaluation and all the other psychiatrists. I did not discount Dr. Young's evaluation, and in fact it does play a special role because he speaks the same language as you. At the same time, Dr. Sorrentino also has specialty expertise in risk evaluation, and Dr. Yaroshenko had seen you for a long time. All of those things are important, and all of those things sort of played weight in this evaluation. In the end, my clinical determination after meeting with you and reading the record was delusional disorder.
What do you mean reading the record was delusion disorder?
Based on review of the record, his determination was that you had delusional disorder.
So you're concerned about because there are many other doctors interviewed Lee, and also they spend too many days interviewed Lee. That's how you weight the two kinds of evaluation.
Objection,
No.
that's not what he said. He's
No.
already given the answer twice. He said that his review of the record, other psychiatrists, Dr. Young's report, his own clinical judgment based on his own interviews review over hours and days led to his opinion. If you want to keep asking, I'm going to object at a
Okay.
certain point.
Okay, because Dr. you view Dr. Young's opinion based on the hours, correct?
No.
So can
No.
you say the question again, please?
Because you review Dr. Young's diagnosis and concern about how many hours Dr. Young spent with Miss Lee, correct?
Objection, I don't understand the question.
But you don't, you understand me, do
If you
you?
understand the question, you can answer it.
Do you understand my
I
question?
believe so.
Yeah.
Dr. Young had spent less time with you than many of the other psychiatrists. That is true, yes.
And is that the reason you did not pick up Dr. Young's opinion?
No.
Why?
The reason that I came to diagnose you with delusional disorder was based on not only the review of Dr. Young and the other psychiatrists, but was primarily based on our clinical interactions together over hours and days.
So clinical activity,
Judgment.
Judgment, interactions.
okay, clinical judgment. But do you understand all your clinical judgment use the Miss Lee's second language, correct?
Yes.
So all the other judgment use the second language. And only Dr. Yang interviewed Miss Lee with her first language. And you still choose the diagnosis with second language, correct?
Objection, you can answer if you understand.
Okay. I based my evaluation primarily on our clinical interactions, which was in your second language, and also was very clear to me that you understood what I was saying and I understood that what you were saying, just as in any other clinical encounter. Yes.
What is that? I mean, I don't understand, okay. How can you make sure Miss Lee understand you clearly?
Ms. Lee, we went over this about
No.
15 minutes ago. You asked him the exact question, how you
did.
understand and how he understands
Do
you.
you, okay, do you have any certain standard for to communicate to people? Means if you have any handbook or some psychiatric theories to judge someone understand you
You use,
very well.
You use your judgment as a clinician.
So everything depends on your judgment, correct?
Yes.
What about if you said Miss Lee understand you, and Miss Lee said does not understand you very much, and whose opinion you would pick up?
In any circumstance where either it seems that there's difficulty understanding the patient is having difficulty understanding, or the patient requests, we have a very low threshold for getting interpreter services involved. And we would do so.
That's not my question. Your answer is not what I asked.
I believe it is responsive to your exact question. If you want to read,
So do you understand my question?
why don't you repeat your question?
I answered the question I believed I was
Yeah,
asked.
It was responsive.
But do you understand my question?
I answered the question I believed I was asked.
What was my question?
No, he's not going to start reading back what your question is. If you have another question
Don't
for
ask
him,
me
you
again.
can ask him another question, but he's already responded to your question.
My question is, do you have any psychiatric theory to set up a certain standard to show if you understand, if you believe the patient understands you.
So the exact question is, do you have any psychiatric theory?
Yeah.
No.
No?
No.
So everything depends on your own judgment.
It depends on my judgment as a trained clinical psychiatrist, yes.
Could it be your judgment make some mistake?
Objection.
In this case, it seemed quite clear to me and to all the members of the treatment team that you were understanding what we were saying and that what you were saying was quite clear to us.
So Miss Lee was saying quite clear to you in your memory.
Yes.
Can you pass me, please? Yeah.
You want to mark it as an
Thank
exhibit?
you. Yeah. Well, another one.
What number would that be?
I think that was the last one. Was the last one 15?
Yeah, 15.
Are you good? Do you want to take a break?
I think I'm okay.
Do you want to?
I'm okay.
You're empty.
You're right.
So the diagnosis you made for Miss Lee was delusional disorder, correct?
I believe the exact diagnosis is that you had a psychotic disorder and that delusional disorder was the most likely psychotic disorder that you had, yes.
What's the difference between psychotic disorder and delusional disorder?
A psychotic disorder, especially in this case, is when a person has a false fixed belief, a belief that is consistent and untrue. Delusional disorder is one class of those psychotic disorders where it is around a certain subject and there's not disorder of mood or other kinds of thought processes. Delusional disorder seems the most likely diagnosis at that time.
Do you remember any fact to support your diagnosis? You said Miss Lee was delusional disorder. Do you remember any fact?
Yes.
What kind of, if you remember?
My recollection is that you had a pervasive feeling that you were persecuted in your workplace at Raytheon, by the legal court system, and even sort of on our unit, that you had this pervasive feeling that you were being discriminated against, persecuted, that went across multiple settings, and that really formed the basis of delusional disorder.
What means pervasive?
Pervasive.
Pervasive.
All over. That
All over.
it is not just a single person or thing, but that you were discriminated against by many people in the same company, many people in the court system, many people in many places.
Could that be a miscommunication? Because Miss Lee only complained certain people. Did Miss Lee tell you she complained lots, many people?
I don't recall.
You don't recall. Then how you get the idea? Miss Lee complained almost, as you said, so many people. How did you get such an idea?
Clearly it was through some combination of the record and from speaking to you.
What kind of record?
The medical record.
What kind of medical record?
It's from MGH.
The inpatient medical
What
record.
other record would that be?
Then could the medical record from MGH, but the medical record is not a fact. The medical record is somebody's, the hospital, MGH wrote down. I mean, if you said Miss Lee complained so many people, there must be some fact existed. So could be those medical record produced by miscommunication since the beginning.
Objection, you can answer.
Your communications always seemed quite clear.
My communication always seems quite clear.
It seems extremely hard to believe that there would be miscommunication, that people would so consistently misunderstand you.
That is your idea. Miss Lee speaks pretty good English, correct?
My clinical judgment, as I've mentioned, is that you were able to both comprehend and communicate in a very clear manner over our many interactions together.
If Miss Lee is able to comprehend and everything's good, then how could she suffer delusional disorder?
Sure. There is a difference between the ability to comprehend and the actual diagnosis or having of psychosis. Many people who have psychotic symptoms have the ability to comprehend and communicate quite well. The two are quite different.
Which are quite different, the two, or what do you mean?
The ability to understand and whether or not a person has psychosis.
So, Miss Lee had a very good communication with you.
Yes.
But Miss Lee, you still believe Miss Lee complained so many people.
I believe that Miss Lee had a delusion about being persecuted, yes.
But Miss Lee did not complain so many people. This is a fact. She only complained certain people.
Objection, is there a question there?
Yeah.
What's the
So
question?
question means, could this be a miscommunication?
Miss Lee, we've been over this pattern of questioning for the last 10 minutes. He has indicated on multiple occasions that he had no trouble communicating and that you had no trouble comprehending and expressing. We're getting back to the same point over and over again. He can answer this question one more time, but I'm going to instruct him not to answer if you keep on going over this same topic. If you want to ask him one more time, he can answer it, but
Okay,
if you touch this topic again, I
Fine,
will
we
object.
change the topic.
Okay.
Okay, we change the topic. All the communication you share with Miss Lee in English, correct?
Yes.
And for your diagnosis, have you ever concerned about the culture issue?
Yes.
What kind of, if you can explain?
A person's culture, where a person had come from, where they were raised, and their overall culture certainly can play a role in their life experience. Absolutely, yes.
And did you discuss any culture issue with Miss Lee?
I don't recall.
You don't recall. And let me, can you tell what this is?
No. This looks like a crane.
Yeah, I can explain to you. It's generally it's a news about the Chinese workers working in Israel. But the Israel company owns their salary about more than $5,000. They did not pay them. Then 3 of them climb on the crane to protest. Then eventually police and ambulance all come, they negotiate it. They got the payment. You understand such an activity?
I understand what you're telling me, yes.
Yeah.
Is there a question?
You understand, have you ever met some people acted like this? No.
You.
Me. So you regard me similar to this one or not?
In some ways, yes. In some ways, no.
And do you think they suffered delusional disorder?
Objection.
I've never met them. I would have no way of knowing.
Thank you. But you believe Miss Lee suffered delusional disorder,
Yes.
and based on which fact?
Objection, we went over for about 10 minutes.
No,
what
I
his
mean
basis-
specifically, what is a big evidence?
He already said that it's the pervasive belief that you've been persecuted across different fields by multiple people. We just went over this testimony not 10 minutes ago.
That is a conclusion. You understand that? But specifically, you did not point out the fact.
You can answer the question, exact same question again.
Yeah. My diagnosis of delusional disorder was based on your pervasive and consistent belief, fervent belief that you had been persecuted at Raytheon by multiple judges in the court system, and even here at the hospital, and that this was a false belief, a fixed belief, and it was persistent across different kinds of settings, and that was the basis of my diagnosis of delusional disorder.
Was that means Miss Lee? You believe Miss Lee suffered delusional disorder? That means there was no discrimination in the company, correct?
In what?
In the company.
In Raytheon company. Was that correct?
Objection.
Because if Miss Lee suffered delusional disorder, there must be no discrimination.
Objection.
If there is discrimination, then Miss Lee complained discrimination. Could that be true?
Objection.
My diagnosis of delusional disorder was based not just on your beliefs about Raytheon, but beliefs about
Court
your
system,
concerns about numerous things.
numerous. You mean number of. And Miss Lee complained about the court system. Well, what did she complain, if you remember?
My recollection is that you had complained about at least a couple of specific judges who had ruled against you, and that there was a sense of persecution based on that.
Was that a three-judge panel?
I don't recall.
And you said a few judges. But the three-judge panel, they worked together, made one judgment. So that was only one, if you could concern.
I don't recall.
But in your idea, Miss Lee complained numerous, number of us, correct?
A number of.
Number of judges.
That's my recollection, yes.
Could that be a miscommunication, or because of your lack of knowledge about the judicial system?
Objection.
My diagnosis of delusional disorder was based on my clinical assessment of you, based on your concerns in many different settings and in our clinical interactions together.
Could it be your clinical experience was not enough to give Miss Lee diagnosis?
Objection. We've gone over this. You can answer.
No, I never asked the same question.
You can answer the question.
Okay.
What was my question?
Why don't you repeat your question, if that's okay, just so that
No,
we
I
all
want to
understand.
make sure you understand my question. Why you ask me repeat?
Because we've now had a bunch of discussion about it, I want to
Okay.
make sure I understand the
yeah,
question.
thank you. Could your clinical experience was not enough to give Miss Lee a diagnosis?
I feel very comfortable diagnosing patients with psychotic disorders based on my experience on the inpatient unit, where we see patients, where I've seen over 1,000 patients, and where we see patients from many, many, many different cultures, many different experiences of many ages and genders. I feel comfortable with my diagnosis of
You've answered
you.
the question.
Thank you. This is a hearing. When you set up the, this is what I wrote down on the tape reserved in Boston Municipal Court.
So this isn't a certified copy. This is just
No,
your.
it's not a certified copy. It's my handwritten, but if you want to get some certified copy or something, you can ask from a municipal court. But I just want to make a good communication
And
with.
do you have a copy of the tape?
There's no copy for the tape, but when I was when there was a hearing, I wrote down something.
So these are your notes from the hearing?
Yeah.
And this isn't from the actual tape recording, it's just your own memory of the
No,
hearing?
even tape recording. Do you think I could write down? I'm not a court reporter. I'm not able.
Okay, so
Okay.
these are your notes, okay.
Yeah.
If you have a question, I can reserve my objections based on handwritten notes, but let's go for it.
If you can read through this part, please.
Okay. These are, okay. According to your notes, this says, Attorney Dr. Huffman, do you consider Yang Li to be an intelligent person? Dr. Huffman, yes. Attorney, she offered logic in her reasoning. Dr. Huffman, she has demonstrated that she can discuss sort of concrete facts. However, she is difficult applying those facts on her situation. Attorney, then she has not yet considered that she has delusional disorder. Yes. Has she considered that she has post-traumatic stress disorder? She has said she has currently symptom of post-traumatic stress disorder. I'm sorry. Yeah. She said she has currently symptom of post-traumatic stress disorder.
Do you want him to continue?
I think that's enough. Yes, thank you. Can you repeat these words? I believe,
Okay.
please.
Okay, so Dr. Huffman, sure, I believe Ms. Lee suffered delusional disorder related to her...
Slow down.
Sorry again. Yeah. I believe Ms. Lee suffered delusional disorder related to her perception of being discriminated both in the past by her employer Raytheon and therefore by U.S. court system, and they have declined her case for proper national and sexual discrimination.
Thank you. So you diagnosed Miss Lee because of her perception of being discriminated. But that's one thing. Have you checked, or do you believe if the discrimination really occurred or not?
No.
You believe there's no discrimination in Raytheon.
The question was, did he check?
Did you check?
I did not check.
You did not check. If you did not check, how you believe Miss Lee suffered delusional disorder?
Based on my clinical judgment.
But your judgment, you said you did not check. If you did not check, is that your judgment? So, okay, let's change the question. Is your judgment, was your judgment not including checking the truth?
Objection. You can answer the exact question that she's asking.
My judgment was also based on our clinical interactions and your concerns about being discriminated against on the unit and by the court system and the whole package.
My complaint against the unit, you mean against the MGH? Well, what do you mean the unit?
Yes.
So you give me diagnosis about the delusional disorder, which is because I complained discriminated in the unit.
You were concerned about being persecuted in multiple settings, by Raytheon, by the courts, that you were not being adequately treated or given enough of the right treatment in Mass General. This was a pervasive pattern across settings which is consistent with delusional disorder.
But did you check if it's true, Ms. Lee was discriminated in court?
Objection. He just answered.
No,
that
he only answered for Raytheon. I never asked.
All right, let's go.
No.
Did you check? No.
You did not check whether the discrimination in court was true. No.
No.
And like what you said, you did not check whether the discrimination in Raytheon was true.
Objection. Asked and answered. You can answer again.
But did you check was the discrimination was supposed? Because I don't know how you get the idea. Miss Lee asked complaint discrimination in MGH, but you said you checked you said based on misleads discrimination complaint against the unit, correct?
You were very concerned about being mistreated on the unit, yes.
I was very concerned about being mistreated on the unit. What do you mean being mistreated on the unit?
That you were not being properly treated, that you didn't have the right psychiatrist, the right interpreter, that you were not being correctly understood, when it was clear that you were able to communicate clearly in both directions.
So, you checked if mislead complaint about did not provide Chinese doctor and did not provide interpreter, which means mislead complaint about discrimination, correct?
Objection. That's not what he said.
That's what you said.
That's not what I said, and I believe interpreters were provided to you.
That was okay. So you said, but can you say again, because I don't follow what you say mislead complaint. What is the general sense mislead complaint in your record? What mislead complaint about discriminated in the mental section?
My recollections were that you were not happy with the race of the nurse, the race of the psychiatrist. You didn't like specific psychiatrists because you believed that they spoke to you in a bad tone. Those are some of my recollections.
Was that happen beginning or end of?
I believe there were some of both, some early on and then some at the end.
Was that including mislead complaint about Dr. Yurishenko's defamation, verbally threatened?
Yes, that was probably a small part of it.
So you believe that's delusional disorder when mislead complaint, that's defamation?
No,
No?
no.
So the verbal threat, which mislead said the word verbally threaten is a defamation, that's not become the evidence.
On its
For-
own, absolutely not. On its own, absolutely not.
Now what else?
It is, I'll just try to review again, it is not the single incident, for example, of the verbally threatening. It is the consistent and pervasive experience of being persecuted, Raytheon, court, here.
But the Raytheon court you did not check. My questions focus on MGH. And focus on MGH, like what you said. Maybe I misunderstand you, but I try to understand you in my best. You said complain some doctor or complain some nurse. What else?
Those were basically the ones that I said, that you didn't like the certain doctors, you didn't like certain nurses.
What was that? I did not like a certain doctor means Yurishenko's defamation.
Objection. Ms.
Or-
Lee, you're repeating yourself and
No,
focusing on one thing.
it's not repeating because because
you
you-
are repeating yourself in terms of the defamation for the verbal threatening. You've already asked this 3 times. I'll let him answer
But,
this one question.
but-
If you can formulate a
okay.
question, go for it. But if you are fixating on the same question over and over again, we're going to have a further discussion about instructing the witness not to answer this question. You've been over this about 3 times.
I believe my
Well,
question
ask
is
it.
reasonable.
Ask the question.
But you already said I complain about the defamation of the verbal threaten is not your concern about for delusional disorder.
That's a mischaracterization and a misstatement of his prior testimony. He already said that's
okay.
one piece of his larger pervasive of Raytheon, the courts, And also
but
on the
I
unit. He's already
already-
testified to this.
No, but I already told you, focus on MGH.
Okay, well, if you just want to
And
focus on
for-
MGH, that's fine.
And
but
for,
We've
One at a
already,
time, please.
yeah, we've
One
already,
at a
go-
time.
yeah, we've already gone over this.
Okay.
Ask your question.
okay, except the doctor, what about the nurse, you said? Your recollection, something with nurse?
You wanted an African-American nurse to be your nurse instead of your assigned nurse. That's my
What,
recollection.
what was it happened?
I do not recall.
Could that be very late, only a few days the end?
I don't recall.
You don't recall. Do you know this date for hearing?
There were 2 hearings.
Yeah, this is the second hearing.
Mhm.
The second hearing, let me. Was this your diagnosis? Can you read through the highlight, yellow?
She is focused on working with a certain nurse, wishing she could work with that nurse.
Okay, what's the date?
10/29/2008.
Is this your record? Is this the record you made?
Yes.
Say again the date?
10/29.
10/29. Come on, please. Don't you think the second, even the both hearing occurred before the issue with the nurse?
This particular issue, yes.
Now what else? Did Miss Lee complain everyone?
No.
And you believe this complaint to the nurse is one evidence Miss Lee suffered delusional disorder,
A very small piece.
a very small piece. And did you check the truth?
Objection.
Did you check what Miss Lee complained?
About that nurse, is that
Yeah,
what we're
about the nurse.
The question is, do you recall checking about the nurse?
I remember reviewing the situation and concluding that your current nurse was absolutely adequate to care for you.
You recalled absolutely adequate. And did you ask Miss Lee what had happened?
I don't recall.
You don't recall. Did Miss Lee tell you that nurse erased another nurse name from the whiteboard?
I don't recall.
You don't recall. And did Miss Lee tell you the nurse Miss Lee wanted? Did Miss Lee tell you a certain nurse she wanted?
It says so
She
in the
preferred.
record.
Yeah, and did Miss Lee tell you the reason?
I don't recall.
You don't recall? Did Miss Lee tell you Sheldon Senju, the nurse, spent 20 years in London?
I don't recall.
You don't recall. Could it be you specifically did not write the words in your medical record? Means you intentionally drop some information.
Are you asking whether he's intentionally
Yeah.
dropped some information?
Yeah.
Do you recall intentionally dropping any information in your
No.
record? No.
No.
But you only remember Miss Lee complained a nurse,
Yes.
and that evidence support your diagnosis, delusional disorder.
A very small piece. And as you mentioned,
You've already answered the
Okay.
question.
A very small piece. And so whatever Miss Lee complained could be evidence, correct?
Objection.
No? Do you recall anything if Miss Lee complained not become evidence to support your diagnosis?
I don't recall.
You don't recall. So, did you pick up Miss Lee's every word back to that time?
The question is, did you pick up every word at that time?
Did I understand what you were saying to me?
Mm-hmm.
Yes.
But why you did not understand Miss Lee want to the nurse who share same background in England?
Objection.
Did you know Miss Lee spent 7 years in England?
I don't recall that at this time. I may or may not have been.
Didn't Miss Lee tell you she spent 7 years in England?
I don't recall.
So, all the useful information you don't recall,
Objection.
and your diagnosis based on some information.
Objection.
What's the question?
The question is you only picked up some information to support your diagnosis, correct?
Objection.
I made my diagnosis based on a clinical evaluation as I do with every patient. This case was no different.
This case, but okay, let me ask other question. How many Asian patients you have met in your experience in MGH?
Should I estimate it?
Yeah,
I mean,
if, you,
yeah,
if you're, if you're
yeah, I only-
guessing,
I only
you
need to
can't
guess.
If you can come up with an estimate, you can certainly provide an answer. If the only way you can formulate would be by guessing, you're not obligated to provide a guess.
My guess is 5%, 5 to 10%.
And in this 5%, do they, these 5% Asian patients, do they grow up in US or not?
Some yes and some no.
And what's the percentage if they not grow
What's
up in
the-
US? What's the percentage?
Percent.
Percentage.
I
And,
would say the majority did not grow up in the U.S.
and do they speak, I mean, you said the majority, do they speak good English?
Some yes and some no.
And what's the percentage they don't speak good English?
I probably can't give you an accurate estimate. There are some who speak English very well. There are some who do not. We get interpreters as needed.
So you give them interpreters
As needed, yes.
as needed. Thank you. It's back to the hearing. Okay, if you can read through this down, I mean my note. If you want to have a certified transcript, I mean you can order from a court. I only have a part of a small record.
And these are your notes.
This is only my notes.
Sure, that's fine.
Yeah, if you can read through this.
I
please.
believe I read this earlier, right?
You read this.
Yeah.
You already read
I
this?
already read
okay,
that.
then read through this part, please.
Read this part?
Yeah, did you read it?
Not that
No.
part. Dr. Huffman, certainly there are lots of patients with or without disagree. I